进去脊柱的微创手术，不过脑动脉瘤的问题就已经很多了。我想可能1个小时的时间也差不多，我们把脊柱的这一部分呢留到在下一次。在我介绍赵凯文医生之前呢，我还是要首先呢声明一下我们 FreshLemon 呢是普及健康知识，我们是美国联邦认证的501c 的公益组织。我和雨桐呢是联合的创始人和发起人，谢谢大家的支持。在这个平台上呢，我们致力于传播专业的知识，帮助我们每一个人为自己的健康做出一个更佳的选择。我们呢是以教育为目的，在这里边我们不销售产品，也不能给您提供个人的医疗建议，所以呢不能给您治病。不过希望我们的内容能够在精神上和知识上给您赋能。我在这里边呢还是要感谢我们的合作伙伴 ANACP 和 Cassie Fun Fitness。ANACP 是我所在的华人医生的组织，Cassie 健身呢是我每个星期天跟大家一起健身的平台。在这里呢，我也是欢迎大家和我们一起健身。如果您扫进我们的群码，您就可以得到更多的健身的信息。星期天早上8点到9点，我会和大家健身；星期二的晚上8点到9点，是王医生和大家健身。不过这个星期二呢，因为王医生有事情，我会和大家交流，希望大家能够参与。那我们的6个群呢都不能再继续扫进了码了，那我们建立了第7群，欢迎大家参与。那赵凯文医生呢？我就说今天在百忙之中能够抽出时间，我们非常的感谢，让我们真是以热烈的不能鼓掌的话，我们是以鲜花和这个我们的感谢的这颗心呢和 heart 来欢迎赵凯文医生跟我们分享。赵凯文医生呢，他是在新泽西州的 Rutgers University 的医学院完成了神经外科住院医生的培训，随后呢是在 University of Arizona 接受了微创外科手术的专业培训，现在是在新泽西州 Hackensack Meridian Health Riverview 这个 hospital 这个医院呢任职做神经外科的医生。做一名神经外科的医生是非常不容易的我就说今天不只是他利用他的业余时间跟我们分享，同时呢我知道他家人呢还刚刚做完了手术所以呢我真是从心里面非常的感动那好，那下边呢我们就把时间交给赵凯文医生我们赵凯文医生，您可以来share 你的 screen 好吗？
好，等一下我看看。
对我们在群里边呢有很多的问题我是不是应该首先 stop sharing？ 好，我现在我 stop sharing， 是不是你可以 share？
应该没有问题。等一下，我看一下。
好，
这看得到吧？
看得到
好，
好，
好，那谢谢孙医生的介绍，也谢谢 FreshLemon 这个平台。其实我的医学中文不是很好，尤其是神经外科方面的，所以今天我不好意思，我得用英文来跟大家讲一下这个脑动脉瘤。
我可
So
以翻译对
好，没
没
问题。
对我尽我的能力去翻译，我也不是说非常的好在医学
对，所以I think in the beginning I'm going to give a little introduction to cerebral aneurysms first. So as we know, cerebral aneurysm is when you have a small outpouching of a normal blood vessel, and the fear is that this small outpouching, this balloon, may rupture in the future. And
好我 sorry， 如果我稍微
没问题。
对，那就是赵医生说，首先这个问题就是说什么是脑动脉瘤，对吧？那 呃，就是动脉瘤呢，是我们血管壁上的一个薄弱环节这个薄弱环节呢，造成了血管壁呢会突出您可以看到这个动脉瘤的这个形状是像一个小球形的。好，下一个那动脉瘤
So
您接
so the prevalence of cerebral aneurysm in the world is about 3%. And usually the mean age is about 50. And after 50 is actually more in females than males. And the reason is people say that because of decreased estrogen production, the vessel wall becomes very weak. And so that's why females have a more tendency of getting cerebral aneurysm. And the
啊。
annual rate of rupture is actually very low. It's about 10 per 100,000 people.
嗯，好，那大家可以看到这个动脉瘤呢，虽然说我们听的不多，可是也有3%的人有大概这是全世界范围内，一般呢都是在50岁左右发病，是这样吗？那50岁以后呢，女性更加普遍，这是为什么呢？这也是我们群里边的一个问题，说为什么我自己其实都不是特别清楚那是根据是因为我们的雌激素降低在更年期以后，雌激素降低以后，造成了我们的血管壁薄弱那幸好呢是说rupture 就是破裂的可能性呢不是很多，在10万个人里边能有10个。那我想问一下，那女性破裂的危险性高不高呢？跟其他的人跟男性比呢？
Yeah, females has a little bit higher rupture rate compared to males for the
哈
same reason.
OK OK，那能不能问一下，那补充雌激素会有没有好处呢？
Some people actually is a very good question. There are some studies that showed women who are on oral contraceptives, or if they have a hormonal replacement, some studies have shown they have a lower rate compared to other females who are not taking them.
OK，好，那就是说，那还有呢一个就是说，经常我也是，我不太测这个妇女的这个 estrogen level 是吧？因为那个周期的变化，可是50岁以后，如果用补充剂的话，这个有没有说 study 说到达了哪一个的水平的话呢，会降低这个发病或者是降低动脉瘤破裂的可能呢？
I don't think there's a specific number,
嗯
and it
哼，
is not a recommendation to
对，
replace estrogen just to decrease aneurysm formation because of how low it already is.
那虽然呢，我们现在已经知道了，可能更年期以后女性的发病率增加和雌激素降低有关，可是呢，我们并没有说建议每个人都去补雌激素，因为这样的研究呢，还不够全面，是吧？
对。
好，嗯。
And people ask why do we have aneurysm, and just like you said, um, sometimes because of genetic disease, like some kind of kidney disease, what we call autosomal dominant polycystic kidney disease, or some connective tissue disease like Marfan's or Ehlers-Danlos, or because of high blood pressure, smoking, high cholesterol, alcohol, or drug abuse. The wall becomes there's a lot of stress on the vascular wall, and when the stress happens, the wall kind of undergoes remodeling and undergoes changes. And these changes make the wall very weak. And that's why when you have a weak spot, the aneurysm forms.
嗯。好，那我们通常会问的一个问题呢，就是说，我们为什么会什么样原因会造成血管壁的薄弱呢？这有很多原因。我们知道基因的因素，如果您有家庭的病史的话，会增高同时呢。 其实最常见的基因的问题就是 autosomal dominant 的 polycystic kidney disease， 就是多囊肾。多囊肾呢，也是一个非常不能说是非常普遍，是最多的我们遗传病之一，是每400个人里我知道就会有1个人会有多囊肾。所以现在呢，随着我们影像学的发展呢，实际上很多时候都会是意外发现，一下子发现了。那这样的人群呢，实际上您要跟您的医生沟通。其他的我们的危险因素呢，包括高血压、吸烟高胆固醇、过度的饮酒用这个drugs 用这个我们非处方的一些呃叫 addiction 的 drug 是吧？应该怎么翻呢？就是illegal 的 drug 非法的药物，对吧？包括您说的 oral contraceptive， 刚才您说oral contraceptive 可能会就是oral contraceptive 就是我们的避孕药避孕药您刚才说有可能还降。
Yeah, I don't think this is probably this very controversial. I think if you're over 50 for oral contraceptives, I think it has a protective effect. But I think we are young. That's probably what they're saying. But I don't think there's much data on this, so I wouldn't worry too much.
OK， 好，那对，这也是群里面问过的，就是说到底吃避孕药又对这个脑动脉瘤是不是会有危险？那如果说已经是有脑动脉瘤的家族史，您是不是建议他不吃避孕药呢？或者是说避免吃？
No, I don't
没
think
有。
there's no recommendation against it. So you can definitely take oral contraceptives.
OK， 不过我们在临床上呢，有一条就是吸烟的人我们不用，还有高血压的人我们不用所以这个呢是要提醒人注意的。我基本上就是吸烟的，尤其是35岁、30岁以上的吸烟的人，我是尽量不去用这个避孕药，口服的避孕药。好，那好，下面
魏医生，群里
好
有人说，他们说先让那个 Kevin 医生讲完，然后您再就让大家再提问，也就是您在翻译的时候就不要提问，可以吗？
好因为sorry，OK， 可以我们先让赵医生讲完。好
Okay. This slide is easy. The aneurysm can happen pretty much anywhere in the blood vessel in the brain. There are many different blood vessels that can happen in any location. And so people say, how do you diagnose the aneurysm? As we can see, the left side is the CAT scan, and the right side is the MRI. On a regular CAT scan and a regular MRI, you can't really see the blood vessels. All you're seeing here is the brain tissue, and this is what we call CSF, which is a fluid inside the brain. And on the MRI too, this is just regular brain tissue, and this is the CSF in the ventricle in the middle, but you don't see blood vessels. So a regular CAT scan and a regular MRI, unless the aneurysm is extremely large, which is very uncommon, you can't really diagnose an aneurysm off of these two studies.
好那我们就说 CT 一般的 CT 是 MR 和 MRI， 你们是看不到这个脑血管瘤的。好
And there's a special sequence called CT angiography or MR angiography. And these two studies, so the CT study, what happens is it gives contrast, and you can see the blood vessel lights up with contrast, which are these bright spots. And this is the aneurysm right here. And there's something called MR angiography, which is the one on the right side. To get an MRA, you do not need to get contrast. And they use a special sequence to look at what's called time of flight, to look at blood flow and visualize blood vessels. And there you can see this is aneurysm here. So these two sequences are the first two images we usually get for aneurysms.
好，那就是说我们要诊断这个动脉瘤的话，需要特别的 CT 和 MRI， 是需要造影的。
And the most important, once everything is confirmed, And there's sometimes we do something called a catheter angiogram or something called a digitally subtracted angiography. And this is when you go to the cath lab. It's a small procedure where you go from either the groin or the wrist, and they put a catheter in, and they go to the blood vessels in the neck or the brain, and they shoot contrast and take X-rays. And here you can see aneurysm over here and aneurysm over here.
那最精确的诊断呢，就是我们要做导管的这个注射影像的诊断呢是最精确的。那这个导管呢是可以从你的腹股沟或者是你的手腕来进去，然后看造影机看到你的脑血管。好。
Yeah, and then they can do, with the modern technology, they can do 3D reconstruction, and you can clearly see the small aneurysm on the blood vessel.
这个很清楚啊。
Yeah, and then so then people ask, what are the treatments for aneurysms? So there are a few different ways. The most traditional way is surgical clipping, means we do a traditional brain surgery and put a metal clip at the base of the aneurysm. And then there are some endovascular methods by going through the groin again or the wrist, where they could put coils or stents to close out the aneurysm.
好，我们在手术上呢，现在有几种方式可以来治疗这个动脉瘤，是吧？这个我不知道你有照片和我们分享吗？好
，So yeah, so the first one is clipping. You put it's just like a metal clip. You put the clip at the base of the aneurysm, so blood flow will not go in anymore.
那这个是不是要做开颅的手术？要从脑？
对，这个是做开颅。Yes,
对，这个呢，就是说你脑上面有一个疤，有的，好，就是一定要从脑部进去，然后看到这个血管，然后夹住它。
Yeah, and I have a small video. I don't know if you want me to show it or not. I have a small video. Should I show it?
Oh, yeah, of course.
Okay. So this is, I don't know how well you guys see, but this is the brain. And here you can see this is the clip. We stop the blood flow temporarily that go into, so this is the aneurysm here, and these are all normal blood vessel. And this is the clip that pinches off the aneurysm from the base. And once this clip goes on, then the aneurysm is inactive. Then there's no more blood flow that goes into the aneurysm. So that's the surgical procedure. And there's another way of doing it, depending on the location and the size of the aneurysm, is something called coiling. And that goes through either the groin or the wrist. And what they do is they put these metal coils and they coil, they form little balls inside the aneurysm. And sometimes it takes one, sometimes it takes five. Eventually, the coil will take up the entire space of the aneurysm. So again, the blood flow will not get into the aneurysm anymore. And that prevents the aneurysm from rupturing.
对，赵医生的这图片已经很好了，就不用翻译，就是自己一看就知道，这coil这个线圈儿，我觉得这是非常聪明的。它不需要开颅，它直接是从血管进去，也就是说从腹股沟啊，从你的手腕呢，直接放一个血管，就像我们注射静脉一样进去一个导管，就可以把这个线圈放进你的脑子里边去。
Yeah, and this is a video of, you can see the coil is coiling up inside the big aneurysm. And at the end, you can see, sometimes it takes a lot of coils, but eventually they'll fill the space with the coils. And another more recent, well, when I say more recent, it's probably the last 10 to 12 years, is something what we call a flow diverting stent. What this is this is also endovascular, is not open surgery. We deploy a stent at the base of the aneurysm. And what happens is this stent diverts blood flow away from the aneurysm, even though you can see there are holes. So there's still some blood getting into the aneurysm, but because the flow of the blood flow gets reduced so significantly, this aneurysm actually starts clotting off. So there starts to form blood clots inside. and eventually this aneurysm wall just kind of reforms and completely closes off. So this is a more recent meaning about 10 to 12 years advancement.
我觉得这真是很不简单。这个呢是像支架，像我们说的心脏的血管的支架，可这个呢是支在你的脑子里边，它呢挡住了这个血液呢进入这个动脉瘤，这样的话呢，这个动脉瘤的地方呢就慢慢的会死掉了，也就
And this is a little bit hard to see, but you can see the stent being deployed right around here. So when we talk about aneurysms, we're always worried. People say it's a ticking time bomb in your brain, because at any time, at any point, anywhere, it can rupture and explode. So the next question really is, what are the risk factors for brain aneurysms to rupture? And there are a few. The most sorry, I think that just give me 1 second. Let me put it back. Where'd it go? Hold on. Sorry about that. Okay. So what are the risk factors? One of them is there's many studies in neurosurgery that has looked at the risk factors for rupturing. The most important one is size. So the bigger the size of the aneurysm, the higher chance of rupturing. And usually at this point, we use 7 millimeter as a cutoff. So anything less than 7 millimeter, we consider very small. And without any other risk factors, the chance of rupture for a small aneurysm is almost 0%, maybe like 0.4, 0.5% every 5 years. So the chance is very low. As you get larger, and especially the giant aneurysm, like 2 centimeters, those aneurysms are the ones that are more likely to rupture. If you have the people that looked at, if you have history of hypertension or high blood pressure, there's higher chance for rupture. If you have a family history of aneurysms, and nowadays there are other studies that show that even with family history, especially with 2 family members in the first degree, there's a much higher rate for rupture. And if you have more than 1 aneurysm in the brain, there's also a higher rate for rupture. So there are a few things that we look at to kind of get an idea of how much risk you have for having a bleed. And when it does bleed, it's quite significant. There's significant consequences to a bleeding aneurysm. We usually say about 1/3 of the patients don't even make it to the hospital, and a 1/3 of the patients that do make it into the hospital have significant neurologic deficits, and only about 1/3 of the patients that have a bleed from an aneurysm kind of survive with minimal deficits. So it's a very morbid condition. So a bleeding aneurysm is about 5 to 7% of all the strokes. And the symptoms of bleeding aneurysm usually is very severe headache, what we call a thunderclap headache, like a sudden onset, worst headache of your life kind of symptom, usually means or is suspicious for aneurysm bleeding. And the incidence of aneurysm bleeding has been decreasing because there's more elective procedures that treat aneurysms, and nowadays people are generally living a healthier life compared to before. People, they control their high blood pressure and they quit smoking, so the incidence of a brain aneurysm bleeding is much less. And when there's a term that's called subarachnoid hemorrhage, and that's usually the type of bleeding from an aneurysm. But there's actually 2 types of subarachnoid hemorrhage. One on this side is a typical bleed from an aneurysm. Another one is what we call traumatic. Sometimes people bump their head or get into a car accident, and you can see on your your radiology read, and it says traumatic subarachnoid hemorrhage. That has nothing to do with an aneurysm. And I think there's there's a big question on family history. So there's a study pretty extensively on family history. So if you have one first degree relative, meaning your parents or your sibling, the chance of a lifetime risk for a rupture aneurysm is higher compared to someone who doesn't have a family member, and the chance of having an aneurysm is also slightly larger than somebody who doesn't have any family history. But the most important thing is when you have two or more family members, first degree family members, that have a brain aneurysm, then the risk significantly higher. Number one is that finding an aneurysm, or number two of bleeding from an aneurysm. So this is why the screening for an aneurysm, for cerebral aneurysm, the recommendation is if you have two family members who have brain aneurysm, especially if they bled, then all the family members should get screened for brain aneurysms. And the most important question is, do all aneurysms need to be treated? And the answer is no. There's a lot of factors that go into the consideration of treating aneurysm. The most important thing, obviously, is the size of the aneurysm. If the aneurysm is tiny, like 1 millimeter or 2 millimeters, you can barely see on imaging. The chance of that rupturing is extremely low, especially if you don't have any risk factors. So what we do in that situation is we do surveillance imaging, meaning in a few years, we get another imaging to make sure that this aneurysm doesn't get larger. There are studies that show if the aneurysm gets larger on surveillance imaging, then there's a higher chance for that aneurysm to rupture. And if that's the case, then we treat it once we see that the aneurysm is getting larger. But if a tiny aneurysm stays the same, a lot of times it doesn't need to be treated. If you have like a 7 or 8 millimeter aneurysm, the same aneurysm in two different patients, one of them sometimes doesn't even need to be treated. Because if you think about, if we were talking about an 80-year-old or 90-year-old who has an aneurysm of 8 millimeter, the chance of a rupture in her or his lifetime is very low. But if it's a 7 or 8 millimeter aneurysm in a 15-year-old, then obviously, that person has another 60 or 70 years to live, then the chance of rupture in that person over his or her lifetime is much larger. Then we definitely would recommend that person to get treated. If you also have a small aneurysm, but you have a whole family history of aneurysms, and especially with bleeding, then we absolutely recommend that to be treated. So everybody is very different, and every individual, their circumstances are very different. And you just have to find the right neurosurgeon to have the right discussion. I've also had some patients who are very nervous and very anxious, even though their aneurysm is very small, but they can't stop thinking about it. Every day, it affects their life, it affects their work. They can't go to work, they can't perform because they're so worried about their aneurysm. In that case, obviously, we recommend that to be treated so the person has, ease of mind and can live their life normally, as opposed to be in a constant state of fear. So all these things need to be taken into consideration when we look at aneurysms. So it's a very comprehensive discussion with the patient. And between the two modalities, some people ask, what if, should I get treated with surgery or should I get treated with endovascular? That discussion is also between the patient and the surgeon. Some locations of the aneurysm are much better treated with endovascular because surgery has more risk. Some locations are actually better treated with surgery. With the surgery clipping, because it's a metal clip that pinches it off, the chance of that to recur is almost less than 5%. But with endovascular, the chance of recurrence is slightly higher, about 10 to 20%. So that's why we recommend younger patients, like if in the 20s or 30s, if their aneurysm is in a good location, in a safe location that can be treated surgically, we recommend them to be treated surgically. But let's say a patient has a lot of medical comorbidities, like they have heart failure, they have other medical issues. Sometimes endovascular is safer because it saves you from going through a big surgery. So those are also the decisions that we make. So that's kind of what I have for a short presentation, Dr. Soon. So if you have any questions.
我就说我们群里确实是有很多问题，
对呀，
谢谢。我就说这个 overview 非常好，让我们大家有一个基本的概念，我们再回答群里边的问题呢，就更有针对性。因为我
对，
知道我们很多听众呢是说。是中文的，英文不特别好，所以我刚才就是尽量的翻译一下。我也是说，catch up 一下刚才您说的。实际上呢，我
好，
我我觉得您说的非常的就是很重要的一条呢，就是说，这个是不是需要做手术的问题是因人而异的，对吧？这个是需要您和您的医生去做很重要的沟通。这是根据您的刚才讲的这几个重要的地方，就是说您的这个动脉瘤的大小，对吧？刚才说到7个毫米以上的就算大的那就是破裂的可能性就会大。还有你的家族史，你的家族史有一个就有危险性就很大了，可是有2个就是有大概有10%的可能性就会有破裂。那这个一般的医生是主张的。还有您的年龄，您的年龄越小，你每一年去 rupture 去破裂的可能性就越大。所以呢，越是年轻，我们越容易越是希望您做手术。那还有一些因素，就是说你是不是紧张或者是其他的一些精神因素，还有自己的自愿，有的病人呢就是自愿，我愿意把它做掉，是吧？那这个
对，
呢是需要您和您的医生的沟通。那这里边我就说，我的问题是很多，我一会儿也是，我是想说，尽量先把我们群里边的问题先解答好，然后呢，我们每
可以。
一次呢，在有时间呢再解答我们 Zoom 的朋友的问题。好那就是像您说的，这好像一个定时炸弹，很多人都觉得非常担心经常我会听到的病人问的问题呢，一个是我的血压控制在什么情况最好还有呢就是说我能不能做运动？我做运动的时候血压就会升高了我这个是不是做运动的时候也要去监测我的血压，或者时不时的监测我的血压，不要太超标了？这个是
I
怎么
think
看？嗯
yeah, for in terms of blood pressure, we recommend blood pressure to be just kept normal. So I think the recommendation now is less than one systolic, less than 130. So just a normal blood pressure is fine. You don't have to go more than that. And in terms of exercise, we don't have any limitation on exercising. You can exercise. I mean, we encourage exercising, but the most important thing is making sure the blood pressure is under control, just in day-to-day living.
嗯。那关于这个举重，您是怎么看？因为它会突然间让那个脑的压力增高，或者是血压升高因为我还有一些更多的是有胸主动脉瘤的一些病人，很年
Hmm.
轻，他们有
Yeah,
的人就不敢去运动
yeah. I mean, we don't have any
嗯
contraindication for exercise, including
OK，
lifting. We tell the patients they can, exercise all they want, because what happens is that the the reason why aneurysm forms and the aneurysm rupture is a long term process. Is
嗯
the remodeling of the vascular wall. So that
嗯
that's usually caused by a long-term high blood pressure and not a high blood pressure during exercise that very transient is usually caused by uncontrolled hypertension for a long time. So
，OK。
as long as you control the long-term disease, but a transient usually is not, we don't limit people for exercise.
好，您说的非常好，那我就说我就放心了。就是有动脉瘤的朋友们，只要你血压得到控制你还是可以继续做各种各样的运动好，那关于这个筛查的问题，其实我也有一些问题，就是你既然如果有家里边有2个人有1级的，对吧？1级亲属有
Hmm.
2个有动脉瘤的话呢，我们是建议筛查的。那筛
Hmm.
查的年龄是从什么时候开始是如果是第一次是正常的话呢，您觉得大概多少年以后可以再继续，还需要再筛查？
Yeah, that's a good question. For screening, so usually, like you said, 2 family members of first degree that have
嗯
the original recommendation, things that have ruptured aneurysms, then that's a
嗯
recommendation to get screened. And the
嗯哼
screening method we usually use is something called is an MR angiography. So it's an MRI. And
嗯
as you know, MRI, you have to stay, the MR angiography, it probably takes about 20 minutes. So usually we recommend when the kids, whatever age, that they can sit still in an MRI. So 9, 10, something like that, you can get screened already. The only time we recommend rescreening, meaning you screen one time and it's negative, and then you need another screen, is when somebody has autosomal dominant polycystic kidney disease. So that population of patients, we've seen that you may have a negative scan, and then I think we recommend every 5 years, and we've seen people grow aneurysms because they have autosomal dominant polycystic disease. But if you don't have that, you just have family history of aneurysm, we usually just screen once, especially if somebody's already grown, like a full adult, 30, 40, 50 years old, we usually screen once. But if you're kids, then we may screen again later on.
OK，好那我就说我再总结一下，一般来说，如果家里边有2个1级亲属的话呢，我们是建议赵医生建议从大概90岁，只要是他能够在核磁共振里边待20、30分钟就开始要 screen 如果是阴性的话呢，那就看以后的情况，是吧？不一定说一定要再去复查可是呢，对于有多囊肾的病人是每隔5年需要再复查的。好，那群里边也有问这个筛查是MRA 和 CTA 哪一个更好那您刚才已经答了，是一般我们 screening 是用 MRA 对吧
？MRA so MRA number 1, there's no radiation because it's MR, and MRA you don't need an IV. The MR angiography is they use a special sequence called time of flight, which does not require IV contrast. CTA number 1 is CT. You need you have obviously radiation exposure, and number 2, to get a CT angiography is IV contrast. So you need first you need to get labs to make sure your kidney function is good, and then you get an IV with contrast. So all the studies show that MR angiography, MR is just as good as picking up aneurysms. But if you really want to know which is, for a neurosurgeon, which one is more accurate, then probably CT angiography is more. We have better data, but for screening purposes, I think MR angiography is good, is perfect.
好，那我们说 MRA 是比较好的筛查的方式，因为它不需要有 radiation， 对吧？有放射性没有，也不需要打这个静脉注射，所以很方便，20、30分钟就可以做好。可是哪一个更精确呢？赵医生说是 CTA 更精确那就是说那需要有一些特别的情况会用到，对吧？对，那我再看一下这里边的筛查的问题对，如果他有，比如说胸主动脉或者腹主动脉瘤以后，因为这个动脉瘤可以发生在身体的任何地方，对吧？那这个时候又有高血压，比如说又有吸烟，一些其他的因素，那您是建议做这个 MRA 去筛查吗？
There's really there's no clear recommendation to get screened if you have a thoracic aneurysm. There are some studies that show there may be a correlation between them, but I think the reason is, like you said, the people who have thoracic or AAA, they have the same risk factors like high blood pressure, smoking, and all that. So is there a correlation? There is a small correlation, but there's no recommendation to screen for brain aneurysm in those patients.
对，就现在我们的怎么说呢？建议吧，还是说不需要去筛查可是呢，您还是要控制您的危险因素这个呢是一定的就是说我们要控制我们能够改变的这些因素，包括血压和这个吸烟不吸烟，对吸烟的人现在越来越少了，这是非常好的事儿。不知道现在 vaping cannabis 是不是对这个aneurysm 会有影响呢？
Actually, I'm not very sure about that data. I haven't read. I know cannabis doesn't have a correlation, but vaping, I haven't really read up too much on vaping. Yeah.
那我想肯定是那个刚才我们说的 illegal drug，就是非法的药物，包括 cocaine，
Oh yeah, cocaine.
methamphetamine，那
Oh yeah.
是肯定有的，对
Yeah,
吧？
肯定有呀。
对对，那是肯定有的啊，所以不要用非法的药。这些酒精肯定也会过度的饮酒啊，是吧？那还有朋友说，那我在中国、在美国得到治疗是一样的吗？这个中
Yeah,
国，
yeah.
嗯
They're I mean, nowadays these treatments are the same everywhere. For
嗯
big countries like China, U.S., Europe, they're all pretty standard now.
嗯。好，那个这个全世界应该都是一样的，那就非常好。那你在美国呢也是，不管在什么地方都应该是一样的这个治疗方式。那想问一问，如果是没有破裂的这个动脉瘤，要进行这个手术治疗一般呢手术的时间是多长？然后需要在医院里面多长时间？
Yeah.
然后术后的恢复，会是一个什么样的状况？
Yeah, I mean,
这个
I'll
我指
speak.
的是没有 rupture 的就是
对，没有
没有
rupture,
破
yeah.
裂的这一部分
Yeah. I'll speak a little bit more on the open surgery because that's what I do. For elective open surgery clipping, the recovery is actually pretty good. Especially if you do it minimally invasive. Sometimes there are people traditionally the incision is quite large, but minimally invasive we do a very small incision just at the hairline. And the good thing about aneurysm is the aneurysm are not really inside brain tissue. It's in what we call an arachnoid plane, which is outside of the brain tissue. So especially if the surgeon minimize trauma to the brain, the patient can oftentimes go home maybe 2 days from the hospital. That's typically what we see for minimally invasive surgery for treating aneurysms, about 1 or 2 full days in the hospital. For endovascular is even quicker. Endovascular coiling or stenting, usually they just stay overnight. So the next day they'll go home. So both methods, especially if it's done correctly and minimally invasively, they are not in the hospital for that long.
好，那一般他们sorry，我要翻译一下，就是说手术，也就是说我们需要开颅，就即便是微创开颅的，那一般是2天住院，是吧？
对，差不多。
比以前呢要就是刀口呢要小很多。如果你是真正的做血管的微创手术的话，大概第2天就可以回家，所以恢复应该是很快的。有没有说这个大概有多少人会有这个 complication？
Yeah, complication from surgery standpoint is elective surgery. Usually is about 2-3-4%, something like that. It's quite low. Endovascular, I don't do endovascular myself, so I can't really comment too much. But from what I see, endovascular complications also on the low side. They're pretty comparable. Yeah.
OK 所以呢，有合并症的可能性呢也是比较低的，大概有2%到3%。我有一个病人，他好像总是觉得记忆力不好啦，就是跟以前好像脑力不一样了，这些有多普遍，或者是说心理作用也很大。
Yeah, I mean, we see it sometimes after surgery, especially open surgery, but they usually are temporary and they usually get better, with 4 to 6 months of time. It's very rare for, brain fog or memory issues to last more than a year,
OK，
especially if you're very careful with the brain. Yeah.
那就是说，即便有一些，比如说你觉得记忆力不好了，或者认知的一些问题，大概4到6个月都会好
嗯
啊。其实您刚才说的，我没有翻的，就是说脑动脉瘤的位置，实际上大
嗯
家总是认为是在脑子里边，不是的，是在脑子外边啊。就是
嗯，
说，我们脑子的那个白层的外边，所有的血管都是在外边的啊。
对
这也就是说好的地方呢，就是说你开颅以后呢，实际上不需要。进脑子里边像取肿瘤一样的把它挖出来
对，
啊，实际
嗯哼
上就是在外边把它修复解，所以这个手术呢，就是一般呢还是稍微快，而且呢愈后呢会比较好的啊，是吧？
对，
好，那如果是说不幸 rupture 那这
嗯哼。
个会有什么变化吗？这刚才您说的，
Yeah. Rugal rupture, after it ruptures is much more complicated. Automatically, you're in the hospital for 2 weeks. The
嗯
minimum, 2 to 3 weeks is the minimum. The reason is usually, like I said, usually the patients are very sick. They're usually
嗯
one of the sickest patients in the hospital. Sometimes we require what we call a ventriculostomy, which is a drain that we put into the head and the drains outside to relieve some pressure. And that
嗯
sometimes can get converted to what we call VP shunt that then goes into the belly.
嗯
And the reason why the patients are in the hospital for 14 days is when it bleeds, the blood kind of dissipates throughout the whole brain, not just where that aneurysm is. It travels in that space and it dissipates throughout the brain. And about 7 days or so, the blood starts to break down and releases chemicals, and that causes other blood vessels that are normal to start what we call spasming. So the blood vessels may close, and then you may have a stroke. So you're in the hospital for a long time to number one, monitor that, and number two, to treat it if that happens. So that's why patients are generally quite sick, and they're usually in the hospital for at a minimum 2 to 3 weeks.
对，如果说是动脉瘤破裂的话呢，那至少可能在医院要待2个星期。很多人呢都会做分流，因为颅压会高啊。
Mm-hmm.
这个分流呢就是鉴定你的颅压，然后再修复这个动脉瘤。嗯那愈后呢也是因人而异的，我觉得是吧？
对，
嗯嗯。那这个里边呢，也就是引出来一个我们群里边的问题，他说他是脑动脉瘤破裂以后手术，放置
嗯哼，
了脑积液的引流管，
嗯哼。
他现在是恢复了，他问要定期做什么样的检查，他还需要注意些什么事儿？
So usually when you have a VP shunt, it's under the skin, and
嗯
we don't have any limitation. You can do pretty much anything you want. The only thing you
嗯
have to worry about, number one, is a shunt. There's a little valve that usually sits either behind your ear or somewhere up here. And sometimes that valve is what we call pressure regulating valve. So that valve controls how much fluid it comes out. Sometimes it's what we call a fixed pressure valve, meaning there's consistently there's only one rate of the fluid flowing out. Sometimes it's called a programmable valve, meaning we
嗯
can use a little magnet and change the setting.
嗯
So some of the valves, if they're programmable, when you have an MRI for any
嗯
reasons, you need to get that valve checked because the MRI machine sometimes can change the setting by accident. Other than that, if you're living life totally normally, you don't need any checkup. You don't need any scans, only if something doesn't feel right. I've seen patients that have shunts that go 30, 40 years without a single problem. I've also seen patients with a shunt that has 10 surgeries in 2 years for revisions. So it's really just luck, unfortunately, because sometimes
啊
the shunt can get infected. And the shunt, if you think about it, just a tube. It goes from the brain to the belly. It's the elastic tube, and the tube
嗯。
sometimes can clog, and that will require further surgeries. But a lot of people don't have any problems with the shunt for their whole life. Yeah.
好，那就说回答这个朋友的问题呢，就是说一般来说，你做了分流，你不需要做特别的，也不会影响到你的生活，对吧？可是，是这样吗？一般的来说，不会影响到，
对，不会影
哈
响一般的生活。
对，不会影响一般的生活，也不需要你自己去做什么，可是如果说他有症状了，因为这个我们这个分流呢，指的是从脑部分流到腹腔，对吧？的这么一
对
个分流管儿这个分流管儿呢，它呢有一个压力阀儿，刚才你说的是吧？这个叫
对
pressure valve，这 pressure valve 呢，它决定了。这个压力就是有多少个液体能够从这儿通过，是
对
吧？这个阀儿呢，有的时候会有些故障，会引起来这个压力的变化，那这压力的变化呢，我想可能就会引起来头疼。如果说
对
问题有问啊，
，Yeah. If
是这
there's
样吗？就如
anything
果他
wrong,
有
yeah, if there's anything wrong with the shunt, a lot of time you have headaches, or when the shunt doesn't work, the fluid builds up, so you get more sleepy. So during the day, you're sleeping more, you're drowsy, you don't have energy. Those are usually the early symptoms.
OK，那好，就是说，如果有这个也分流管的朋友，不管是什么原因的引起有这个如果你有说头疼非常感觉无力你就跟你的医生沟通，是吧？还有的一个危险呢，就是您说的 infection，就是会有发炎这个呢也是需要注意的一件事情是吧？
Yeah.
那好那这个问题还有一个问题呢，不是特别相关，可是既然问了呢，我也是因为他呢想说他经常是耳鸣，然后耳鸣呢是那个波动性的 pulsatile
Mm-hmm.
tinnitus，所以他担心呢是 aneurysm，或者是说我们叫动脉瘤静脉。anyway，
Mm-hmm.
就是 AV malformation，right？
Mm-hmm.
或者是动
Yeah.
脉静脉之间这些
Mm-hmm.
有问题或者
Mm-hmm.
是也是静脉瘤之类的问题您看这个会有多普遍？因为
Yeah.
pulsatile，
Yeah, I've seen it. First of all, I think obviously go see a ENT or to get initially checked out. But sometimes instead of aneurysm, when you have pulsatile tinnitus, when you start hearing your own heartbeat inside your ear, a lot of time is not an aneurysm, but it's something like you said, what we call a dural AV fistula, a dural arterial venous fistula. And sometimes a transverse sinus or sigmoid sinus dural AV fistula in this area behind the ear can cause those symptoms. And you can pick it up by having a CT or MR angiography. So I would say definitely go see an ENT first, and if they look into the ear, if there's nothing in the ear itself that explains it, maybe you should get a scan to look inside the brain.
对，一般我们其实特别好，我们的这个医院，如果我们不太 sure 的话呢，我去 order 这个 imaging 影像学的话，他会给你一些 guide，就问你是 pulsatile，是不是跟你的血管一样的，他就会指导你去做。像这个朋友呢，他确实是需要跟医生沟通，看一看
对
需要做什么样的这个检查，是吧？那基
对。
本上呢，我们的问题在群里的问题就答完了。那关于动脉瘤的，下面我看一下这里边还有什么问题肝脏的血管瘤不需要治，这个我可以帮您回答啊。对，颈动脉的斑块和动脉瘤有关系吗？
没有关系。
没有关系。好啊，对，动脉瘤的症状和表现
对，如果 if it's an unrupture, it didn't rupture. Most of the times, there's no symptoms if you have an aneurysm. It's not very rarely. Sometimes if what we call there's a PCOM aneurysm, so aneurysm at a specific artery is very close to what we call the oculomotor nerve. So sometimes the aneurysm can point in a location that compresses on a nerve, and then you may have trouble with your eye movement, but that's pretty rare. So very rarely you may have issue with your eye movement, but most of the time, an aneurysm is generally asymptomatic.
嗯。对，大多数的动脉瘤它是没有症状的，这就是说很多人只是追踪就可以了。可是动脉瘤如果压迫了神经，对吧？可以造成视力上的变化，包括重影啊，它也会造成一些头痛啊，很奇怪的头痛啊，这些都会有的。我就说，如果您是高危人群的话呢，您可以跟你的医生去沟通。最后一个问题，我想您已经回答了，不过这里边他又再问了2次，我还是跟大家，跟您问一下。他说他是，被诊断的是没有动脉瘤的蛛网膜 subarachnoid hemorrhage，就是蛛网膜对，他说他做了 CTA，没有发现问题，这个时候是不是一定要做 catheter angiogram 啊
？100%，100%要做 catheter angiography。如果你有一个 subarachnoid hemorrhage，如果不是跟trauma 有关系
，trauma 有关的，
对，如果不是跟 trauma 有关的，there's something that we call a perimesencephalic hemorrhage，就是 subarachnoid hemorrhage， 但是没有在 CTA 或者在别的影像上面没有看到aneurysm。在这样的情况下，usually we wait for 1 week， and we do a catheter angiography, or we do a catheter angiography already. 就刚到医院的时候，我们就已经做了一个 catheter angiography。如果第一个 catheter angiography 是 negative， 我们大概等1个星期到2个星期左右，再做一个 catheter angiography, just to make sure there's no aneurysm. Because a lot of times what happens is when you first bleed, the blood is very thick, and occasionally, very rare, it's not common, but it's quite rare, but it happens, is the thick blood can push on the aneurysm. So when you do those studies, it doesn't show up. But about a week, the blood dissipates, and then the aneurysm pops up, and then you do the study again, and it shows. I've seen about twice or 3 times in the last nine years or so. So it's very rare, but it 100% happens. So that's why we always recommend not just 1 catheter angiography, we actually recommend 2 when it happens.
好，那我就说这是较重的朋友，你要在场的话要记住，是要再去做。可是，一般来说呢，都是在医院里边隔1个星期，等到血液已经吸收了以后呢，再做。那他说呢，他现在已经是在恢复，可是觉得疲劳。刚才就说到锻炼的问题，那我就说可以慢慢的去。可是如果说他已经出院了，这个时候还需要做什么样的追踪呢？
如果这是做完就是都 aneurysms already treated, or this is the one that's negative?
And this seems like from the question is the CTA was a negative for sure.
Oh, this is the same person. Yeah.
So the same person. And
same person,
so,
okay.
And then the 7th, right.
Yeah, so if the CTA is negative, but you never had a catheter angiography, you should absolutely get a catheter angiography.
Okay.
Yeah, unless the subarachnoid hemorrhage is caused by trauma, then but if 如果if you're just walking around and you had a big headache and they found subarachnoid hemorrhage, you should definitely get a catheter angiography.
OK， 那这里边呢，我也是提醒大家，就是其实呢，我知道了好多朋友，他就是以前有高血压或者血压都不是说特别高，有一点点，然后突然间中风然后到医院里边就说是中风实际上这个呢也是有 aneurysm 的可能性，对吧？如果是确实是在蛛网膜下腔出血的话呢，一定是要检查是不是有动脉瘤那光是影像学还不够就是一般的影像学还不够，还确实需要做导管的影像才可以，最后来证实排除这个问题。那如果说这个他的 aneurysm 也被修复了那这样的朋友们，他还在需要复查 make sure 没有第2个或者第3个因为他是不是会有更多的可能性会有呢？
Yeah, so usually if the aneurysm is clipped from
嗯哼
surgery,
嗯
we
哼
usually recommend getting a catheter angiography in a year. And if
，OK，
that 1 year looks good, you
嗯
pretty much don't need to get another angiography for the
嗯
rest of your
嗯
life because the clipping is much more durable. So if
嗯
1 year everything looks good, that aneurysm coming back is very rare,
嗯
almost impossible.
嗯
But if you're treated endovascularly, they will want to follow, meaning you probably need to get at least some kind of MRA or even catheter every few years, because there's about 10 to 20% chance if you're coiled or put a stent in, there's about 10 to 20% chance it may come back. So they need some kind of follow up every couple of years.
啊，就是说，你如果做了动脉夹的这个手术的话，1年以后复查没有问题，你也不需要再继续复查了。
嗯
可是你
嗯
要是做就是这个线圈儿的这个手术的话呢，因为复发率会比较高的话呢，你要跟您的医生会定期复查。
对，
好吗？那我们现在已经到了7:05左右了那我们今天的讲座呢就先到这里我就说，我 OK，我还是要再 share 一下我们的群码，
好，
而且好，我就说在这里我们再一次感谢赵医生他的时间，在百忙当中跟我们分享这么多的信息，解答了我都不是特别清楚的一些问题，我在这里面学到了很多东西，非常感谢那也希望您的家人就是早日恢复那我们以我们的heart 心和我们的鲜花来感谢赵医生，今天对我们这个群的付出，好，谢谢大家，
那谢谢。
好，那我也是说，我们就是付诸行动的，就是我们可以做的事情，就是锻炼身体有一个健康的生活。所以呢，我们每个星期有2次健身的活动，我也是希望大家能够参与。那在我们的群里边呢，我们会有这个信息会跟大家分享那如果您愿意进群，可以提前问您的问题，这样的话呢，让我们的专家有有针对性的准备他们的讲座的话呢，也希望您扫群码那现在我们是第7群，谢谢大家。那我们今天先到这里，下个星期呢，我尽量的会跟大家分享膝盖的第2部分。就是关于关节炎的一些治疗和跟大家继续分享膝盖的一些运动，好吗？也希望大家能够参与，有收获。好那我们今天就先到这里，好哦，我看雨桐还在吗？OK。